But we're going to look at our soft tissue and fascia. And that's that whole thing where fascia seems to connect the entire body so beautifully. And that's why we do see problems between the neck and the knee. We're going to look at and show you a couple of different videos of assessment techniques that you can use. We're going to then go into the bone and joint area, and then following it to neural. And these are the things that I find probably make the best changes to our clients. The common muscles, looking at our upper body, the anatomy of the neck. When we look at the anterior portion, we've got all of the omohyoids, the sternohyoids, the sternocleidomastoid, really important because of its attachment posterior laterally. I'm also mindful of the sternalis muscle groups as well, because the sternalis will make effect on the clavicle, which then makes an effect on the soft tissue structure. Looking at probably the first region that we mostly complain of as therapists, most clients come in to see us with that suboccipital tenderness, suboccipital pain. Just remembering that we've got our rectus capitis minor and major, and our inferior and superior, which are more lateral and to the movement patterns.
Okay, so can you line it back for me? Okay, so the difficult point in this maneuver is actually to get your hands on the right spots. Now I'm using Zach because he's got very little hair, which is great, versus longer haired girls, but this is the line of our occipital ridge right along through here, and we're going to get the last points of our fingers, those end digits, and we're going to cut them just behind the mastoid process and along that ridge. So you've got the little finger, that fifth raise, almost at the inguinal, and round we go. And I'm going to do the same on both sides. So Zach's head is cradled in my fingers, and I gently pull it so there's some traction, not a lot, just a gentle traction. Zach's now going to work his eyes. What we're doing is we're creating some reciprocal inhibition between the optic muscle and the suboccipitals. All right, so Zach's going to relax his head. I'm applying that traction, and Zach, what you're going to do is you're going to, without moving your head, look down towards your toes. So he's holding his head still. He's looking down, and I'm applying some traction at the back of his head. With their head in the center and dropping one ear down, they might feel restriction on the left or compression. And the other way, they could feel only big stretches through here, maybe stretches down the back of the neck, or compression again. And again, inflection and extension. So this is a really good way to release off a lot of the muscles that attach to the cervical joints. We're looking at our upper trapezius, of course. We're looking at our levator scapula. Also considering our splenius capitis and our splenius cervicis, our sternocleidomastoid, and our scalenes. So we're going to address all those muscles in one simple, easy move. The way we're going to do it is by a myofascial release movement, and I like to use some kind of generic lubricant, not a lot, but just enough that we can slide over the skin. And we're going to be working along the upper trapezius region, all the way down the back of the spine. So we're going to pick up levator scap, trap, and down through the erector spinae of the thoracics. And we're also going to be working through the anterior portion. So get enough lubricant that you're not going to be really burning the skin when we're going through our range. So